Burnout and overtraining. Burnout and overtraining are becoming increasingly prevalent and significant within the world of sport and exercise. As the pressure to win increases, athletes and coaches spend more time training and feel more stress, which sometimes leads to overtraining and burnout. Burnout can definitely happen in a professional realm for athletic trainers as well. The hours and longevity of the job become a grind, and many times people don't feel that they're appreciated, which leads to burnout and people ultimately leaving the profession of athletic training.
Sometimes there is confusion between periodized training and overtraining. Periodized training is the deliberate strategy of exposing athletes to high volume and high intensity training loads that are followed by a lower training load, a rest, or a taper. The goal of periodization training is to condition athletes so that their performance peaks at a specific date or at a particular time frame. Periodization involves a series of training cycles or planned changes that maximize a body's system to adaptations for a current cycle or phases while preparing you for the next. In periodization models, the overall program is partitioned into specific time periods. The longest time period is called a macrocycle, which is typically a year in length. Embedded within the macrocycle are at least 2 or more mesocycles. Each mesocycle may last several weeks to as many as several months. A mesocycle's length is dependent upon the goals of the athlete, the number of competitions scheduled, injuries encountered, training setbacks, or anything else that may change the goal of a particular cycle. Each mesocycle is further divided into microcycles, which are typically 1 week in length but may last as long as 4 weeks. The goal of this brief cycle is to focus on daily and weekly training variations. A microcycle lasts 5 to 10 days, but more typically a week because of the difficulty in developing a training plan that does not align itself within the weekly calendar. Mesocycles are a block of training, usually covering 4 to 12 weeks, and consist of some number of microcycles, which emphasize the attainment of a particular goal. A macrocycle is a long stretch of training which is intended to accomplish an extremely important overall goal. We also have overtraining. Overtraining is a short cycle of training during which athletes expose themselves to excessive training loads that are near maximum capacity. Overtraining results in overloads that have either negative or positive consequences. As we train, we continuously push ourselves to overload. This is how we build strength, flexibility, and endurance. Or we can have maladaptations and decreased performance if the overload is too great. Usually, inadequate rest will result in a decrease in performance. There is a fine balance to try to establish as athletes are training. We want to push individuals as far as we can into overload, but we do not want to push them into the negative side of the overload. Therefore, it is important to understand that one athlete's overtraining might be another athlete's optimal training program. Overtraining occurs as a process over time. This process begins with the overloading of the athlete. This could be something like moving from 2 miles of running a day to 10 miles a day in 3 weeks. This results in overtraining and overreach, where we see a decline in the performance of the individual. When overtraining optimally taxes the performer, if the body adapts and supercompensates or positively overtrains, we see improved performance results, which are box A. If overtraining demand and overload states are excessive, the body may not properly adapt, and overtraining and poor performance can result, which is box C on the bottom. It is possible that overtraining will not improve or decrease performance. It will only maintain it, which is box B. From this, we can see how important rest is for an individual. Training must be individualistic. The difference between overtraining and periodized training depends on an individual's capabilities and their needs. Staleness is the physiological state of overtraining, which manifests as a deteriorated athletic readiness. A stale athlete has difficulty maintaining standard training regimens and can no longer achieve previous performance results. When an athlete is overtrained, their physiological, psychological, biochemical, and immunological symptoms are all negatively affected. Overtraining can halt an athlete's recovery process for up to 72 hours, which is bad for the athlete and team performance. Burnout is a physical, emotional, and social withdrawal from a formerly enjoyable sport activity, which is characterized by emotional and physical exhaustion, reduced sense of accomplishments, and sport devaluation. Exhaustion can be both physical and emotional. This often occurs in the form of lost concern, energy, interest, or trust. Feelings of low personal accomplishment include things like low self-esteem, failure, and depression. This is often visible in low job productivity or a decreased performance level. Depersonalization and devaluation is acting in impersonal and unfeeling ways. This is due in large part to mental and physical exhaustion. The individual essentially stops caring about the sport. Burnout occurs as a result of chronic stress, a perceived or actual imbalance between what is expected of an athlete physically, psychologically, and socially, and their response capabilities. This can also occur from motivational orientations and changes in the athlete. This means essentially that the athlete's motivation to continue to participate in sport has changed or even been eliminated. Athletes are starting to train at younger ages. Training in many sports is virtually year-round. Overtraining symptoms increase as the volume of physical training increases, and overtraining symptoms decrease when physical training volume decreases. Other investigators have linked non-sport stress from such things as occupational and educational demands, finances, and living arrangements to the onset of overtraining. Significant relationships exist between burnout, or the amount of stress an athlete feels, and their social support and coping skills. Other factors related to burnout include a lack of free time, parental pressure, lack of autonomy, social support and money hassles, early sports success, a lack of recovery, passion levels, perfectionism, and peer-related motivational climate. One study examined team handball athletes and found that those athletes that had a low burnout profile were 2.21 times more likely to continue to play and 2.86 times more likely to play at a national or professional level. This means that individuals with higher burnout profiles were more likely to remove themselves from sport participation. Researchers have examined the causes of burnout in junior tennis players. 4 factors were identified as concerns leading to burnout for young athletes: physical, logistical, social or interpersonal, and psychological concerns. Physical concerns include things like erratic play, injury, and feeling tired. Logistical concerns included things like travel and demands on time. Social or interpersonal concerns included negative parental influence and negative team atmospheres. And lastly, psychological concerns included inappropriate expectations, feelings of lack of improvement, and coach and parental pressure. There are many signs and symptoms of overtraining and burnout that will be exhibited. These signs and symptoms affect individuals both physiologically and psychologically. There is a more complete list of these signs and symptoms within the textbook, but we will highlight the most essential ones to look out for in our athletes. We'll start with physiological signs and symptoms. These could include things like sleep disturbances, appetite loss, decreased performance, greater fatigue and tiredness, overuse injuries, increased illness, usually due to immune system deficiency, and elevated resting blood pressure and heart rate. Psychological signs and symptoms of stress include emotional exhaustion, feelings of apathy, a lack of energy or lethargy, increased tension, greater feelings of dejection, concentration loss, mood changes, concentration problems, heightened anxiety and stress, and antisocial behavior and even isolation. Overtraining affects an athlete's mood state and their performance. Athletes have increased mood disturbances under especially heavy training workloads. Successful athletes exhibit high levels of vigor and low levels of negative mood states. This is considered an optimal combination. Overtrained athletes show an inverted iceberg profile with negative states pronounced. Overtrained and stale athletes are at risk of developing mood disturbances. Mood disturbances can result in decreased performance levels and eventual dropout. Therefore, more training is not always a better option for an individual. There are multiple models of burnout. Some of the most common will be quickly discussed. Cognitive affective stress model. The concept of cognitive appraisal reflects the idea that nothing is either good or bad, but thinking makes it so. People differ in how they respond to prolonged stress in sport and exercise settings. Negative training stress response model. This model focuses on the physical training, but recognizes the importance of psychological factors. Physical training stresses the athlete physically and psychologically and can have positive and negative effects. Positive adaptation is desirable, and negative adaptation is undesirable, leading to overtraining, staleness, and burnout. Unidimensional identity development and external control model. For Coakley in 1992, stress is involved in burnout, but it is only a symptom. The real cause of burnout deals with faulty identity development and external control of young athletes. The structure of sports prevents young athletes from spending enough time with their peers outside of sport. This causes a sole focus on identifying with athletic success, which can be unhealthy, especially when failure or injury occurs. The social worlds of young athletes are organized in such a way that their control and decision-making are inhibited. Commitment and entrapment theory. Burnout is explained within the context of sports commitment. Burnout occurs when athletes become entrapped in sport and they feel that they must play even though they lose their motivation for participation. The self-determination theory. People have three basic psychological needs: the need for autonomy, competence, and relatedness. Those who do not have these basic needs met will be more prone to burnout. And lastly, the integrated model of athlete burnout includes theory principles from several of these areas combined. We can try to measure burnout in individuals. The Maslach Burnout Inventory was created to assist in burnout evaluation. It is a reliable instrument for measuring burnout that has been adapted and modified for use in sport and exercise. The Maslach Burnout Inventory subscales include emotional exhaustion, depersonalization, and personal accomplishments. The Maslach Burnout Inventory has been used with professionals in a variety of potential stressful occupations, such as nurses, lawyers, social workers, physicians, psychologists, police officers, counselors, and probation officers. It has been especially useful in studying teachers, whose work environment typically includes long hours, excessive expenditure of mental and emotional energy, and high expectations from principals and parents. Burnout is common among athletes, but also the sport professionals who work with the athletes day in and day out. Sport professionals, such as certified athletic trainers, officials, coaches, fitness instructors, administrators, and physical education teachers, can all suffer from burnout as well. The most common factors related to burnout for certified athletic trainers are a type A personality, role conflict and ambiguity, and occupational stress and work-family conflict. The most common factors related with burnout in coaches are pressure to win, administrator or parental influence or indifference, disciplinary problems of the athletes on their team, multiple roles, extensive travel, intensive personal involvement, home and work demands, difficulties handling the high performance demand of elite sport, a lack of tools to facilitate recovery, gender differences. Females tend to have higher burnout levels, but not in all cases. Age and experience differences. Younger coaches appear to have higher levels of burnout. Coaching style. Coaches who are more caring and people-oriented appear to be more vulnerable to burnout. Coaches who have better relationships with their athletes are less likely to burn out. Coaches who feel entrapped are at high risk of burnout. What is the social support? The greater social support is associated with lower burnout in coaches. Lower organizational support, less perceived control, and less active coping styles were related to the highest burnout in coaches. Factors related to burnout in officials include job satisfaction, making bad calls, a fear of failure, and role conflict and ambiguity. Factors related to burnout in sport and fitness professionals include pressure from coaches or parents, hard training schedules, and competitions over long periods of time. There are multiple strategies to help treat and prevent burnout. We want to monitor the critical states in athletes, such as stress levels, training loads, and recovery. We need to communicate our feelings to others. We want to foster an autonomy-supportive coaching style, setting short-term goals for competition and practice, and taking relaxation time or timeout breaks. Some recommended advice for young athletes include playing for your own reasons, balancing your sports and other fun things in your life, trying to make sport participation fun, and trying to take time off and relaxing away from sport. Some recommended advice for parents of young athletes include recognizing what is an optimal amount of pushing, giving support, showing empathy, and reducing the importance of the outcomes, involving players in decision-making, lessening parental involvement, and taking time off to relax. Some recommended advice for coaches include having two-way communication with players, cultivating personal involvement with players, using player input, and understanding players' feelings. We might be asking ourselves, what can we do to prevent burnout in ourselves and others? First, we can become informed. Finding good quality resources is essential. The more knowledgeable we are, then the better we can plan and try to prevent or address burnout symptoms if they occur. Burnout can have very serious consequences for some individuals, including social isolation and withdrawal, quitting sports, and even physical self-harm. Burnout is a very real and underreported state that many athletes experience. Understanding and knowing the signs and symptoms of escalating burnout, along with an appreciation of how burnout occurs, are important steps in the prevention and treatment of this situation, and may well prevent the start or the worsening of a mental health disorder in an athlete. Prevention is key. There's a 5-step strategy to try to prevent burnout in young athletes. Number 1, create a training environment that fosters perceived competence and having fun. Number 2, encourage multi-sport participation as opposed to single sport specialization. Number 3, in striving for perfection, the athlete must have realistic expectations and be able to accept less than perfect performances. Number 4, avoid pressuring the athlete. Perceived coaching and parental pressures can lead to burnout. And lastly, number 5, allow the athlete to have autonomy and ownership over the sport experience. Thank you all, and I hope you had a great semester. I have greatly enjoyed getting to know each of you a little better during this course. Please remember to complete the university course evaluations for all of your courses, but especially this one. You should be receiving an email towards the end of the semester asking for their completion. Your feedback is important and is extremely valued by myself and the university. Thank you all, and go Islanders!